See important safety information at the end of the video.
What I have changed now and who I've seen do better are patients that have had axial back pain, maybe they've had back surgery or not, and the ones that will accept being weaned off their medications, patients that can't tolerate medications. No matter what you've tried for them, no matter how low dose or what agent you've used, they can't tolerate that agent. Those patients seem to do very well with low dose and microdosing therapy in controlling their symptoms. How I proceed with my trial has worked very well for our office in that our trialing is done in a hospital setting to allow us to be, give more time to our clinic and not take over from our clinical time frame. They're done at the hospital over my lunch hour. We use a catheter technique to deliver the intrathecal medication. The patient is monitored in that facility during the trial phase. I come back and check on them after that. When the trial is complete, then I do remove the catheter, obviously documenting that the catheter is fully intact, and put a pressure dressing on that patient. At that time, they're then observed overnight in the hospital for 24 hours to watch for any side effects or complications that may have arisen from that trial. Then they follow back up with us in the office to go over how the trial went, the relief that they received, any side effects or complications that did arise during that trial phase, and questions, comments, or concerns that patient had about the trial experience. In regards to how I handle dose escalation, again, it goes back to patient education and making them understand what our goals are and expectations for that patient. And the education and communication is very, very important. They need to understand that, that relatively they may feel like their pain is worse, but kind of reminding them where they started and what their pain scores were at that time, how much more functional they are now versus what they were when we first started this therapy. And it kind of puts it back into perspective for them. As well as if there is worsening pain, we want to reassess that first. We don't want to just increase the doses of medication without giving the patient a full assessment and making sure there's nothing acute that needs to be addressed instead of just dose escalating.
Important safety information. The Synchromed 2 infusion system is approved for the long-term delivery of preservative-free morphine sulfate sterile solution and preservative-free ziconotide sterile solution directly to the fluid around the spinal cord for treatment of chronic pain. Targeted drug delivery should be considered after the patient has tried oral medications or other therapies that have failed or were associated with intolerable side effects. Implanting the system has possible risks, including infection, meningitis, spinal fluid leak, paralysis, headache, swelling, bleeding, and bruising. Pump or catheter problems can cause a patient to experience overdose or underdose and/or corrective surgery. Errors in inserting the needle into the pump refill septum during the refill procedure can result in medication being inadvertently injected into the pocket, resulting in an overdose that may be life-threatening or fatal. Drugs infused through the system may result in adverse events. Refer to appropriate drug labeling for prescribing information and detailed disclosure. Formulations not indicated in product labeling may contain neurotoxic preservatives, antimicrobials, or antioxidants, or may be incompatible with and damage the system. A prescription is required. Healthcare professionals must review the product technical manual and appropriate drug labeling prior to use for detailed disclosure. For complete safety information about Medtronic targeted drug delivery, call Medtronic at 800-328-0810 or visit Medtronic's website